Hey everyone, welcome to House Healthcare. It is Friday morning, January 12th, and we're continuing our budget adjustment conversation. And today we have Department of Mental Health with us. So there's documents on the webpage. I'm going to turn it over to the commissioner.
Great, thank you. Good morning. For the record, Emily Hawes, Commissioner for the Department of Mental Health.
And Allison Cronk, Deputy Commissioner, Department of Mental Health.
And good morning, I'm Shannon Thompson, the Financial Director for the Department of Mental Health.
Great.
Today's focus will be on our BAA, which includes 3 items. And so maybe we will show those there within the talking points that were provided to folks. Next week, we're here to give an overall system update on Wednesday at this point. Just a reminder that that's what DMH is up to in the next week with you all.
We've seen a lot of them.
This is good stuff. So I'm going to turn it over to Shannon Thompson, who will talk us through the first item.
Okay, thank you. So the first item is the $2.7 million of general fund for the Vermont Psychiatric Care Hospital. We're still experiencing vacancies in direct care positions. And while we've implemented retention strategies, we're still suffering from pretty large vacancies. So travel nurses, unfortunately, are having to fill those vacancies. We have currently about 50 travel nurses right now. And that's the...
I know you're fine with questions as we go. And I also want to say Representative Bloomley from Appropriations is here. And so if you have any questions, just raise your hand.
I just wondered how many total nurses you have at...
Total travelers or total nursing positions?
How many nurses do you have currently working? If you have 50 that are travelers, how many do we have that aren't travelers?
Sure. That's a good question. I haven't been asked it yet, so let me get back to you.
Okay.
Those 50 travelers are covering around 55% of our shifts. They're doing both nursing shifts and a couple of overnight mental health specialist shifts. I believe we have 80 positions open within our nursing department. So I would say we probably have less than 30 total nurses, permanent nurses that are employed.
I'm sorry, can I follow up?
Nursing staff.
I see, I mean, like last year, I mean, I knew this was an issue last year. I remember coming in at BAA. I thought things were like getting better.
That's true.
Would you say things have gotten better than last year, or have they gone back down?
That's a great question. From my perspective, things are getting better. So we have decreased the hourly rate for our travel partners. Last year, they were around $200 an hour. That's not dollar for dollar take home, but those contracts have come down to around 125. So I find that as a benefit. We did go through a market factor adjustment. We're continuing to be on 12-hour shifts. We are seeing an increase in folks applying for positions, but we're competing with a pretty large healthcare system who are also trying to attract nurses and have the ability to have some more flexibility around recruitment and retention. So we've been able to utilize the state system higher into range for new staff, but we are very limited in what we can do for permanent staff.
And not that this is in the BAA, but are you having the same issue at the new secure residential in Essex?
With Essex, they have actually been able to hire nurses, but they have not made much progress with residential counselors, which are your floor staff, like a mental health specialist. And we've changed some of the minimum requirements, changed some of the pay grade to attract folks in. That's within our ability within the collective bargaining agreement. And so we're still working on getting folks recruited into that facility, but they've had some luck with nurses there.
Good, thank you so much.
Leslie?
Thank you. When you contract with travelers, do they require special training to work in psychiatric unit, or you'll just take anyone that?
We will not just take anyone. There is a minimum requirement. Folks do need to have either a psych RN degree or have some experience in working with humans in a similar way that you would. VPCH offers training, but it's still a specialty. And there's a decrease in psychiatric nurses. There's also a decrease in psychiatrists nationwide.
So that contributes to the problem.
Yes, it's a specialty care.
Yeah.
Yep.
All right.
Two questions. One is, do you have, please remind me of what, I don't like this word, but I'm going to use it because I can't think of another one, ancillary staff, like other than nursing, like mental health technicians. How's that looking? And the second question is, as far as travel agencies go, do you contract with just one travel agency, or are there multiple that you work with?
Sure. I'll take the first question first. We do have ancillary staff, mental health specialists. When we talk about them, they're all though part of the nursing department.
Okay.
But what we see is it's most difficult to recruit for the overnight shifts. Even with a shift differential, which means those shifts get paid extra money, it's still very difficult across our system in general to find folks to work the nocturnal shift, which is a 12-hour shift.
And are there travel positions filling those?
Correct. Mostly.
Okay.
Yep. Most of the travelers are going to be on that knock shift.
Okay.
Art? Sorry.
Yeah, and this question.
Sorry, hold on.
Yep.
Oh, I'm
Part
sorry.
two of that is, yes, we have, I think, around 5 contracts with travel companies. We have 2 that we have a lot of luck with sending qualified personnel for us to interview and hire on. But we do have contracts with multiple staffing agencies.
Great, thank you.
Art?
Yes, and this question may be as much for you, Nolan, as for you folks, because you're looking at the chart. I see 2,000,007, 2,000,008 in the line there as an addition. The 25,282 figure above that, is that what was budgeted in the yellow, Nolan, on that chart?
I think-
Under general fund?
CMH can answer.
I'm sorry.
That's fine, that's fine. I can answer that.
Okay, yes, no, I'm sorry.
So the yellow line is our total base budget for fiscal year '24.
That's what was put in.
Yes.
Okay. And so the 2,772 is in addition to that. That's what
Yes, that's
you're-
basically one
That's what
line.
you're asking for in the BAA. Thank you.
I have a question. So you mentioned, obviously it's a very competitive market in Vermont, 14 hospitals, other areas that need the same staffing. And you mentioned the collective bargaining. So do you feel that you can pay at a rate that would help us draw in people and then bring down the travel cost? I mean, if we're paying for travel costs, right, couldn't we somehow shift that money over here gradually and staff it up and have more permanent? So, is there market rate studies that have been done or anything like that?
Sure, and I recommend, so our Human Resources Department is the state Human Resources Department, and they staff recruitment specialists. They also staff folks who do the market factor adjustment and take a look at what pay looks like within the area. An example, though, which is a challenge of working in state government, is we did a lot of really great work, and then 2 weeks later, another hospital came out with a 20% increase for the nurses. And so we're consistently competing with some of those flexibilities that the private system has. VPCH is the only hospital level of care that the collective bargaining agreement oversees. And then So that's a general collective bargaining agreement that is shared amongst all state employees unless there's a separate agreement, like corrections has their own CBA. But around market factor adjustments and analysis, that's outside of my content expertise, but I think they'd be happy to come in and talk about how they define that and the process they use to do that.
Okay, great, thank you. Daisy, I'm looking at some of the questions that you had, so I'm just gonna ask them. unless you want to. Okay, so, Brattleboro Retreat, we needed some housing down there at one point. And has that helped with the staffing and travelers and?
Sure. So Brattleboro Retreat has been able to staff and take folks onto all of their units. What I can't say specifically today is how the housing investments impacted that. So we can follow up and bring some of that information for next week, for Wednesday.
Okay, that'd be great. Thank you. Did you have any others?
Yeah, just kind of as a follow-up, I remember, we haven't heard in this committee much this year about the retreat. I know it's been kind of shifted elsewhere, but for a long time, we were having some, there was a lot of staffing by travel nurses there a couple of years ago. Just wondering if there were any lessons learned in terms of, addressing that as an issue that we might apply to the PCA.
That's a really good question. I'd like to think about it a little bit off the top. They still also have quite a few travelers within their units. So let me come back to that because that's a good question to think about, kind of lessons learned. I know Linda Rossi, who is their CEO, has an extensive amount of training around compensation and retention and recruitment. And so I think that alone, specific to psychiatric hospitals, and so I think that alone is something that the Brattleboro Retreat really benefits from, is having that expertise.
Another follow-up from something you said earlier is we'd asked about the number of contracts you had with travel nurse agencies.
Correct.
There are 5. I know nothing about the contract structure of them, but is there anything in either their contract perhaps with the agency or with the state's contract with the agency that would preclude them from staying on longer or us recruiting?
Sure.
There must be something in there.
Yeah, that's a great question.
If there is something that prevents that, can we prefer contracts that maybe don't prevent that?
Yeah. We're at the, so we have to put out an RFP. So we can't control who responds to an RFP. I'll say that in general, travel contracts last for 13 or 26 weeks. Many travelers re-up and continue to stay with us after and continue to do that because they're there. It's a great place to work. And we have had some success hiring travelers who have been there a while on as permanent staff. And we've been able to do that in the last, 2 or 3 months. So that's a win. What we don't want to have happen, which I'm hearing might be coming, is a clause in those contracts that say that travel nurse is not allowed to work at the facility after their contract ends. And they have to spend a year or so working outside before they can come on as a permanent staff. So we're keeping close tabs on that, but that's right now, I don't believe any of the contracts have that. But that's a rumor that I'm hearing that we're trying to get some clarity on. Right now, none of the current contracts have that. So staff can sign on if they want to sign
Should
on.
you get clarity on that? Could you please let me know?
I will.
Great.
That's federal.
No,
It's a non-compete
no,
clause.
just a non-compete clause.
There's similar things happening from Congress on travel positions, period.
Okay.
similar pressures.
Okay.
Topper? No, because he's there.
Oh, okay.
Wait, hold on. We have people popping and moving. All right, go ahead, Topper.
Okay, I have a quick question. Does the Department of Mental Health have anything to do with the funding of the local designated agencies like Howard Mental Health, Washington County Mental Health?
Yes,
Okay.
we fund them.
That's what I thought. Now, yesterday, we had a request from Howard Mental Health to continue a program that they instituted. Did you get a request from Howard Mental Health to fund that for the next 6 months?
Not that I'm aware of. And so I'll preface yes, we fund them. But all of the designated agencies are able to apply for other lines of business, whether through a grant or through private partnerships. So we, from my knowledge, haven't been approached by the Howard Center for that particular program directly, unless they've come to your team.
I want to verify what program it is.
Cultural liaison program.
It was a VDH program, actually, because it was a CDC grant.
Oh,
That would have
okay.
been through VDH.
Yeah.
It was a collaboration.
Okay.
So they have talked to us about that, yes.
Oh, okay.
So I can brief you, Allison, I think we can brief you on that and we can respond if you need more information about that.
What we're considering as part of the BAA request,
Oh,
we have not decided as a
Okay.
committee, but we heard them to make it part of the discussion we have on whether or not we should fund that program through the end of their fiscal year, which I believe is June 30th.
okay. I mean, from my first response is lots of agents, my guess is it was a grant and the grant is ending. How DMH approaches grants is we really work to try to backfill them to make them sustainable. And so lots of agencies have grants that are probably up for ending soon. But I can loop back to the DMH team to see what is happening specifically with that CDC grant.
Topper, did you have more questions?
Nope, that's it. Thank you.
Thank you. Art?
Yes, Emily, did you just say a few minutes ago that the Brattleboro retreat is fully staffed for all beds to open? Is that what you meant by what you said? I just want to clarify.
So they have all of their adult beds online, and all of their youth beds online. Is that right? Yeah.
Really?
It does
Really?
change off and on.
Now, do we know how many of those beds are occupied?
We can look. There is open beds across our
And I
system.
know this isn't BAA related really, but it's very interesting.
We are coming at you on Wednesday and
Okay.
we can provide a full system snapshot during that update. But there are beds open across the system. For example, with VPCH, the capacity it's staffed to serve 21 and there's 9 people there right now. So the referrals have really shifted in the last few weeks, which is
Okay.
interesting.
Yeah, guess so. Thank you.
Yes, you're welcome.
All right, anything else on the traveling nurses piece? Okay, good.
Okay. So the next item is mobile crisis response, just converting some funding from general fund to global commitment investment. So this, in FY '23 and '24, we requested funds for mobile crisis that also covered the uninsured and underinsured. But for that portion of the funding, it was general fund. We have since applied for a Medicaid investment that will allow us to use global commitment funds to pay for that. So this is just converting that money.
So Daisy, go ahead. I'm sure you have a question before I jump in.
You said me.
I did.
Didn't we last year in the budget move it out of investments? Allison?
The mobile crisis,
And we moved it to block grants, didn't we? We
no.
moved a bunch of stuff out of investments.
That is true. Shannon will be able to explain.
I believe what you're referring to might be the suicide prevention. So there's a lot of things going on. We have the 988 and the suicide prevention and now mobile crisis. So we start out with these programs quite often needing to put general fund in to cover certain costs. I believe what you're speaking about is the position that we had that was all general fund. And last year we converted that to global commitment investment. I believe that's the suicide prevention director position that you might be talking about.
Okay.
And it wasn't funded with block grant, it was funded with general fund. If there's something else, I can certainly do some research on it for you.
Yeah, no, I'll circle back. I could definitely be thinking of something else.
So when we transfer, I'm sorry, were you done?
Yeah.
Okay. When we transfer then to the general fund over to global commitment, because we can make it an investment, which means we're drawing down federal funds. So are we, the amount that was allocated last year to the general fund, are we transferring less because we're going to get more global commitment dollars to, so for instance, if the total was $1 million, and now we're moving over to global commitment, depending on the match rate, I would think we would only transfer 500,000. Is that how it works? Or do you take the whole million, draw down more, and then what do you do with the money?
So it depends on the program, the program's needs. This is a straight conversion of dollar for dollar general fund to global commitment. Okay. So it is a general fund savings.
Okay.
$1 million. Yes. It is not grossing it up to get more.
Okay. So you are taking, basically, it is no longer in the general fund, and we are getting $1 million from global commitment. So it is an investment, not a match rate situation.
Correct.
Okay, that's
Can I clarify?
Yes, please.
So let's say the program was 2.5 million, throwing out the number. You're still spending 2.5 million, but you're saving $1 million. So I should be clear that people aren't thinking you're spending $1 million on the program. It's still a $2.5 million program.
Wait.
So I'm sure people understand.
No, go back. You're starting with 1.5 general.
So the 1 million general fund, do the math here. So the program was probably about 2.2 million, right? So we were using 2.2 million in general fund. And they're saying, oh, we're going to do it with GC. Still 2.2, but we're going to get the $1 million. We're saving $1 million in general fund. But it's still a $2.2 million program.
Well, it's
not
a
clear right
1.7. Yeah, it's a 1.
Okay, yeah, whatever.
Correct. You're right.
Okay, I just want to be clear. So people think it's $1 million program. It's really a higher program, but the $1 million is the general fund savings, but it's still more expensive program. That's what's true.
In my line of questioning was more of, we are taking $1 million from the general fund, now putting it in global commitment where we know we draw down money. Why would we move the $1 million? We should just be moving maybe 500,000 to get to the total cost of what the program is.
Yeah.
But what you're saying is this is an investment, which means it is solely funded by global commitment dollars. Okay.
And not general fund anymore. So it is a general fund savings.
Okay.
But we're still going to spend $1.7 million.
Okay. Are we all on the same page?
Yeah, I did the math wrong. Yes.
That's okay.
Okay. And we will hear a lot more next week about where we are with the mobile crisis program. Okay. And then the PNMI, you might need to explain what this is again.
Okay, so private non-medical institutions, PNMIs, the way that their funding has been has been challenging for the providers. So departments are working with the Department of Rate Setting on some strategies to help that. And one of the strategies was an inflationary increase. That was something that we could implement fairly quickly. And when Rate Setting calculated the need for that, we got that in our fiscal year 24 budget, but the need is actually lower than what they calculated. So this is just a savings because the need changed.
Okay. Can we just explain what a private non-medical?
And give an example. That was.
You want to give an example of a PNMI?
So the, NFI has a what's that?
I think Jarrett House.
Jared House is,
NFI.
it's funded
yes.
through the PNMI program, but it's.
School for Girls. Have you seen our pyramid?
Oh, yeah. Oh, yeah.
So a PNMI traditionally has an education portion as well as a behavioral side. So NFI has a PNMI program as well as their hospital diversion beds.
Yep. Jarrett House, no, Jarrett House is a crisis bed.
What's the NFI one called?
The Jared House in Panama.
Oh, that's right. And Vermont School for Girls is in
That is
there.
one, Vermont School for Girls. Yes.
Never even heard of that.
I'm sorry, I don't remember the names of them.
Oh, that's
I'm
fine.
terrible about
So
that.
it's a classification
Correct.
of
Of a program, of a treatment program.
a treatment
And
program.
it is partially funded by AOE.
Okay, because it has
The educational components to
Okay.
that, plus the programmatic.
Okay, so there we go. Private non-medical institution, children's residential care. Provide treatment for children and adolescents. It's designed to build on the strengths and return children to their homes and communities whenever possible and appropriate. Great. Awesome. Okay. Any questions on that? So can we go, I'm sorry, I know you just put that up. But can we go back to the chart that I can't even read? But what I'm wondering is, can we get a total for the BAA of where, if I add all these up, you're asking for more money? How much more money total? You know what I'm trying to get?
Yes, I don't have that on, do you have that on the ups?
Is it the
Ups and downs?
620?
2576, right? No, it's not 2 million.
2,576,000.
Just shy of.
It's about 2.5 million, so it's for 2 million. I just don't have my spreadsheet up.
Oh, she's putting it back up. There we go. Here we go. Yeah.
Yeah, so, sorry, it's still, you can move it over.
The bottom figure,
It's the, there we go, thank you. It is the orange, the first orange line there, 2,576,479 is the total request.
What's the line underneath it mean?
Yeah.
The orange one underneath it, that one is the total when you add the base budget plus the budget adjustment request. That
Oh, so from the 317,
So it goes from 317, 528 down to, up to 320, 105.
got it.
Yeah.
would it be fair to say that though that the general fund impact is about $1 million? Am I reading that right?
Yes.
Yeah, just about.
Well, the general fund impact, no, it's, there's also a general fund dollar in there. I can give you the total general fund impact. So the global commitment also has general funds in it.
That's what I'd like to know.
Yes, I can do that.
What is the general fund impact? And certainly, what is the general fund impact as a percentage of what was budgeted?
Okay,
In other
I
words,
can
how
get you
much,
that.
what percentage are you off?
Yes.
Thank you.
But wait, I want to clarify that. Isn't Art right that of that 2.57, isn't 996 the general fund component of that?
No, it is not. No, that is the straight general fund. There's still another general fund component in the global commitment dollar.
Right, but that's the straight general fund component,
No.
the 996.
No, there's, general fund is its own fund source.
Right.
Global commitment is its own fund source. There's general fund dollar in the general fund, that's 100% general.
And in the GC.
And in the GC.
So like the match,
Okay,
whatever it was.
Correct. The match is 42 point something.
The general fund for the global commitment piece is coming from the central office. So it doesn't.
Oh, got it.
There's-
Got it.
That's where it's met.
But it's not, so the GCF
Oh, yeah.
piece in here is not DMH GCF. Or I mean, it's not DMH general fund.
Correct.
It's global
Yeah,
commitment money,
yeah, okay.
correct. Yes.
Does everyone understand that?
Yes.
So do we have access to that or
To what?
That would be in the AHS central budget.
Yeah, so it wouldn't be through this. We couldn't say, I mean, I know we're not gonna say no, but
But yes, we see it.
we see it,
Yes.
you see it. I don't
Yes.
know where, we don't see it.
You can see it.
No, but as our committee, we're not looking.
We're not looking at the AHS to.
That's right,
for
but that's
BAA.
where it would be.
Right.
Yeah.
Art, did you have a question?
Yeah, and this was, yeah, it has to do with this, but when we look at the BAA and we add monies to the budget to account for what we anticipate the rest of the fiscal year, the tax money that pays for that from our state taxes has, I guess, been based on the fiscal year budget. And I'm looking at Nolan because you probably would know this more than anyone. When we add to that, how does that money impact the taxpayer?
That's actually a great question. And I would invite DMH to jump in. Basically, what they're trying to do is they're moving money around. So it might be that it's an up or down in DMH, but it's an up or down elsewhere. They're operating from either moving money, like, okay, well, this had more and this had less, we're moving it, or revenues came in higher than we anticipated, so but they're not raising new taxes.
Okay.
It's based on revenues, estimated revenues that we were already doing. So sometimes we see, okay, well, money came in higher from the claims tax, and so we're going to spend it, or money came in less, we're going to cut somewhere in the budget. But unfortunately, it's sometimes money is sort of like we have an up here, but then it's going to capture it down.
Okay, so.
But we're not raising new taxes in BAA.
No.
It's the same baseline. You just had money, more money or less money may have come in and money's moving around.
Okay, and I understand that, and it's really good to know. That, for me, it's good to know. However, if we have a bad revenue year, okay, and this goes up, it sounds like we have to cut something somewhere to make it match.
Yes.
Okay, that's.
Unless you raise taxes, which you're not going to do in the
No, in the middle of the year.
Right.
So.
Okay.
And you would know about that.
Oh, okay, right,
You're
yeah,
not
I
going
guess
to
we
just come
would.
in and then you would know.
About it, that's for sure. Okay,
Yeah.
thank you.
Very good
That's
question.
very helpful.
That's a great question.
Melissa?
So sort of along the same lines, Diva came in yesterday and they had for some in carryover. And I do know the BAA has a significant bit of carryover that it's using. Do you have carryover? Why aren't you?
Carry forward.
Carry forward, carry over, carry ahead. How about carry ahead?
Carry behind.
Do you have carry forward? And why aren't you using it here? And if you're not using it, is it going somewhere else?
And is it on that spreadsheet?
That's a really great question, and yes. So our general fund carry forward we were not allowed to carry forward, it was reverted, and this is how we were allowed to do the cost of that.
Okay, so because I'm learning more about this terminology. So can you explain carry forward versus reverted?
So carry forward, is from the previous fiscal year. At the end of the year, you might have had excess general fund that got carried forward. So we had some programs that didn't get off the ground when we initially thought they would. We had extra money. And at the end of the year, finance and management they make the decision on whether or not to revert that or to allow us to carry it forward. And so that's.
So carry forward would mean you could come to us and say, we have $4 million in carry forward money, and we're using it this way in our DMH budget. To revert it means it goes back to a bigger pool of money that can now be reverted and given to other pieces of state government. I'm gonna let Alyssa finish and then Daisy.
So did DMH have any that was reverted?
Yes,
Much.
the 2.7.
Where's that?
2.7 million.
Oh, where's that?
At the top, for the travel that we're asking for back to cover the travel nurse costs.
So that was reverted, is that what you're saying?
Yeah.
So if it's reverted.
I don't understand. Yeah, why is it there?
in the
Because we were allowed to request that money in the BAA process. Typically, we don't have that much money left over at the end of the year. We might have $100,000. We get to carry it forward, and we don't even talk about it because it shows up in our budget automatically. But this this amount of funding got reverted in that process. And we were allowed to request it as part of the BAA.
So basically, I envision it as this. So you're at a higher level than DMH, all the agencies, all DMH, DEVA, whoever, they're told you can either carry forward or revert it. When you revert it, it goes into a big pot of money. And now you're looking at your BAA request and you're like, okay, we do have a need. So we're going to go back to finance and management and say, we need 2.7 million for whatever. And they, at a higher level, say yes or no. Right. So it's like a
Helpful for hopefully AHS will be testifying, and you'll be able to talk with them a little bit.
We'll add it to our budget discussion. I'm not testifying for BAA, but no, go ahead.
But just at a high level, to go back to Representative Peterson's question, where's the money coming from?
Right.
Money not spent elsewhere, we reused here. And the process for which how they spend that carry forward or revert happens in finance and management.
Right. Daisy?
Are you typically, do you typically carry money forward? Or is it more often reverted?
Or more often you've used everything.
That's
I didn't give her that option.
all over the place during COVID. We, to have $100,000 at the end of the year is not a lot of money in a $300 million budget. So typically there is a process to request to carry forward your money. And so we have done that before. We have had, smaller amounts, not this amount typically, but smaller amounts that might be carried forward.
But like more often than not in your, 20 years? How many years have you been?
Well, yes, we would typically have them. There has been times, more often than not, we would have a little bit of money left over at the end of the year because
And
it's simply
it's carried forward.
really hard to spend down to the penny.
Right.
Even though we would love to. But yes, we would carry it forward.
Yeah.
Answer your question.
Topper?
We would request to carry it forward
Got it.
and have been granted most of the time.
Topper?
Yes, thank you. When we look at the state budget overall during this BA process, the bottom line is the budget is not supposed to increase. Am I correct in that? All the BAA is supposed to do is move money around that's already there. You don't add money to a budget.
I would reframe that. I should say for the record, Noel and I will joint fiscal. The budget is what we pass, and the BAA is we're halfway through the year and we're seeing what we actually may need or what we didn't spend. So in theory, it's just working off baseline of the budget, and what it is the administration coming in saying, we need more here, we need less there.
But correct me if I'm wrong, which I probably am, if revenues are coming in higher and there is a need for additional money in a program, we could add that revenue, right?
But we're not raising new taxes.
But we're not raising new taxes, no.
Just coming in different than projected.
Did that help, Topper?
Say that again. I didn't quite understand that. If you have more money coming in than you thought you had, are you saying that you could change the budget that was approved by the legislature?
Well, that's what the BAA is. It's asking permission from you to change what the budget was.
So for instance, halfway through the year, let's say I am not saying this is what happened, this is a scenario. Corporate taxes are $2 million higher than what was projected when we did the budget. So we have $2 million potentially that if there is a programmatic need or administrative need, that's presented to us as part of the BAA, and then we as the legislature determine whether or not we accept that. And we're going to use that $2 million for that. But no new taxes are being raised. It's revenue that's come in. And Tiff has a question.
So my bottom line, then, a one line question. The BAA can be used to increase the original budget that was passed last year.
Yes,
And decrease it.
and decrease it. So if we have more revenue or less revenue to work with, it could go up or it could go down. But it requires the legislature to pass that.
Yeah, let's see, I just thought that my understanding was you don't increase halfway through the year of the session. You don't increase the baseline budget that was approved. You just move money around. So
It's both.
anyway, I understand what you're saying now. So if
Okay.
10 million come in, we could increase the budget that already was passed. We could use that $10 million to increase, to fill needs that we heard, like Howard Mental Health the other day.
Right, right. But on the flip side, if, we pass the budget in July and in November, there's a recession and we're now down $10 million, we need to use the BAA to cut somewhere to make up for that $10 million.
Adjust the budget.
Adjust the budget. Better word. Sorry, Tiff, and then Melanie, and then.
I was just gonna say that we had a whole presentation today about carry forward and kind of how that system works. That, a lot of the surpluses that at the end of a fiscal year, and at least in certain agencies, is related to vacancy savings. And so, which is in and of itself, I think, a red flag, perhaps. It signals do we have a problem in terms of hiring? We have expectations. We pass legislation that requires, a department to do X, Y, and Z. And if in fact there's a problem in hiring, can we have that expectation? And do we systemically need to change, need to really think about how to reduce the vacancy rate? So anyway.
Yep, good point. Melanie?
I was just curious, I know we had the presentation in December about like the overall and big picture revenue, but when do we find out the actual numbers? Is that now, or is it by department, or?
What do you mean by?
Well, you were saying, well, revenue could be high, it could be lower, like where does that number come?
So what I would say is, that's a different document, but budgets are based on what we project our costs will be and what we think our revenues will be. Based on, so we're budget adjustment, we're 6 months in. We have a better sense of what the trends, both for our costs and our revenue. So we're adjusting it. We still might miss the mark, and that's what's called closeout at the end of the year. And that's where they have, guess what? We had carry forward. But the other thing I just want to remind people is what the budget document is it's basically giving spending authority. And so what the budget adjustment is asking for a change in spending authority, both up and down.
That makes sense?
Yes, it does, thank you.
It's pretty much line item changes.
Yes.
Line item transfers.
Yeah,
Use it where you
exactly.
need it.
Right.
We get more, we use
Right.
it. We get less.
Unless we find something,
Yeah.
find
Okay,
adjustments, right? Sorry, that was way outside of what you came here for, but.
There's so much to
Thanks for triggering me.
So did you all have anything else?
Yeah, Madam Chair, I just want,
Yes.
as a policy, I always thought that we would not increase the base budget unless it was an emergency. So when we go through the BAA, and I could be wrong, but that's what has been in the back of my mind for the 20 years I've been there. We don't increase the baseline budget unless it's an emergency.
So I think I don't know about that, quite honestly. I would say that BAA is definitely not a place for new policy. So if we have if we have additional revenue because we're bringing in more, we're not using that revenue for new policy. We are using it within the policy of the budget that we passed in July.
I get now. I'm on track. That's what I thought. Okay.
Can I add something?
Sure.
One way to look at it, Representative McFawn, too, would be think about Medicaid. We think the caseload costs are going to be X, but guess what? They came in a lot higher. We have an obligation to cover those costs. So they're coming in saying, can you please increase our budget so we can fill that obligation? That's not a policy decision, that's a increase in our obligation needs.
And where they get the money, it's not our problem.
Well, it is your problem, but not this committee's.
Yeah. Here, I had my hand. No one, I don't think anyone can see it.
Oh, I'm sorry, Brian, we can't. Thank you for chiming in. Go ahead.
I just wanted to make a point too about this, which is that it's a two-way street. Like we can't just push this through without the governor signing it or going through the due process and overriding a veto. And likewise, the administration can't just do what they want. They have to. That's why we go through this process. And so I think we go through it in good faith to try to make sure that we are supporting the work of the previous year's budget. And so even if we have the power to increase the baseline budget, like you said, why would we do that? If there was an emergency, we might, and we would have to do that in partnership with the administration anyway. So in the end, I think we have to just remember that this is all good faith negotiations to meet our policy goals of the last year.
Good point, Brian. Melanie?
So I'm just trying to get the concepts in my head. So your ask for BAA is mainly driven by the traveling nurses and the PNMI? Or is there something else I'm missing? Just because I'm trying to like compare it to what the other people have brought to us and kind of.
So that's essentially correct.
Okay.
What's driving our budget request is the travel nurses. We have offsetting savings because we are converting one of our programs from general fund to global commitment, and because the PMI, there's a savings to the original calculation there. So it's all about budget transparency too. So we do have some savings to offer against our request. So we just put it all that's known at the time on there.
Art, and then Mari, and then Melissa, and then we'll be done.
Beyond the nursing shortage and we have travelers, how are the other staffing positions within mental health? Are they filled for the most part, or are we still short?
Sure. From a central office perspective, we are around a vacancy rate of 16%. Both facilities cover anywhere between 40 to 47%. And those are really driven by our floor staff. So we have,
Short staff.
we are short on the floor. Other ancillary positions like psychology, social work, a CEO, director of quality, medical director, operations director, all of those are full. And so that's a great sign. Because you need those positions full to stay in compliance with your regulatory requirements. So most of our open positions are going to be your floor shift, and almost all of them are going to be your overnight shift.
And so their salaries, benefits, the monies for them remain in the budget, I assume?
Yes.
Waiting for someone to fulfill that position.
Well, Shannon can probably articulate this better than I am, but I'm going to take a stab because I've learned a lot of math today. That falls under our vacancy savings. And so that's going to go contribute some to our travel nurse contracts.
Okay.
But not all. Is that right?
That was perfect.
Whew.
And we're all doing
We're all learning something.
Thank you.
Mari?
Moment of levity. I think this would be a perfect time to introduce how pharmacy benefit managers.
I think so. That's like a long conversation.
It's 10 minutes of
But did you have a
12.
question?
No, that was
Okay. Moment of levity, yeah. Okay, so Alyssa, I think was the last one then.
I'm not sure this is a question for DMH. It might be more of a question for Nolan or my budget buddy sitting over there. But like, I'm trying to wrap my brain this year, because I think last year I just tried to figure out what a BAA was. You know, last year, this legislature said and made policy decisions that said, we want to invest $317 million into our Department of Mental Health. And each other subsequent area. The year before, a different legislature made policy decisions that they thought should be invested in DMH. And if there was money that wasn't spent, that carry forward money, I want to make sure that the intent of the legislature to use that money towards our system of mental health is being used for that. I don't want it to go into the general fund for, not that I'm sure they're not wonderful, but like, I don't know, Department of Public Safety, I'm throwing something out there. I want to make sure that the money that every year the legislature deems is the money that we need to spend is being spent in the places that we feel it's needed. And I'm not sure I have clarity on that.
Year to year.
Well, it's just within the year, even. I mean, really, we can't change something that happened in the past, and we're working in our budget year. So 317 million was the total budget for DMH, and then
a carry forward would be the year before's budget.
Oh, to bring that in
Yeah.
to this year's budget.
So the budgeting is clear as mud. The one way to look at it, and again, I'd invite Shannon to jump in, is that 317 is what we thought the need was based on the proposed services. And it may be that the costs were spent were a little less. We're committed to the service and not to the number, right?
Yeah.
If that's the case, then they're coming in, we assume, to say, we're funding all the services that you wanted, we all agreed to, and it may cost a little bit less, or we couldn't get something up and running in time, so there's a little bit of money left over. And here's how we would like to use that money instead, or the difference, and your job would be yes or no, right? So it's just a rejiggering. I don't think generally if there's no new policy, which some stuff is gray, some stuff is policy, say, well, we want to do a rate increase with that. That could be considered a policy decision, right? And so there's some gray area there. But you're committed to the services and not the dollar amount. And so if there's extra money left over, well, if they're doing all the things that you asked them to do and there's money left over, then you have fulfilled that. But it's never that clean.
But if there is money left over, I want to make sure that the intent, what that money was intended for, is going to go back into the same thing that it was intended for. I want DMH to have, and if that means a rate increase or Howard being able to fund their expired grant, I want to make sure that money goes to that purpose, because we made policy decisions.
So one way to think about it too, and not that money moves around AHS, but let's say you want that for DMH, but then let's say DIVA, guess what? They're short $2 million of stuff that we asked them to do. Where's the money coming from, right? So this might be that they have to go back, revert it to central office. I'm not saying this is happening, but I'm just saying in the bigger picture, okay, well, DIVA's $2 million, DIVA's $2 million short of things that we really want them to do. Well, where's that money coming from?
And I think
you gotta think about the big picture sometimes.
And so I think that's really, I agree with you. And I think what Nolan just said is really important. We need to look at all of AHS, right? So our policy decisions affect all of AHS. And so it might be that there's a carry forward in one that needs to go to another because of policy decisions we're making. So really what we should do is have AHS before the start of the budget and just have a conversation with them. But I see where you're coming from.
Just wanted to add one thing, is that these are precisely the questions that folks in the Appropriations Committee are asking to understand, because the BAA doesn't tell us anything about the story behind the numbers that appear in those ups and downs. And so it's not getting an adjusted budget, we're just getting, where are we, taking money away, or reclassifying where it's coming from, or what are we adding to the budget? And so I think that, we can work with the various committees as we understand it better. We've already asked for some reports to become part of the regular conversation and documents that we get from the Commissioner of Finance as part of the budget adjustment to help round out the picture for us all.
Great. We all good?
I just want to underscore Alyssa's point that as I'm reviewing the BAA, I'm challenged even having sat at AHS to follow the thread of the shifts between general fund and global commitment and the policy narrative in the BAA, which explains, the legislative intent of some of these programs. And it's not just the intent of the money. We can listen to that, but it's the intent of the health outcomes. And as we, think about social determinants of health, yes, we need to look at the overall AHS impact and look at it more holistically. And, also I think listen to AHS as partners and their expertise. Most of us are not health experts.
Yes, exactly.
And they are. And so we're partners and thought partners in taking care of the state, but also many of us are experts in our districts, in our constituents, and we have a direct line to what's going on in our neighborhoods. And I think there's a really fine balance between listening to what the experts at VDH say is the latest and greatest evidence and what is happening in their programs, as well as what's happening in their funding. But I also think we have to balance that with what we know our constituents need, because that's also changing.
Yeah.
So I think that's one of the other BAA kind of juggling factors that we do. But I just appreciate Alyssa bringing that point up because it is a real challenge.
Yeah.
It's very hard to follow the numbers.
And I do want to underscore, I'm using the different departments within AHS as an example, but it's even more so, I want to make sure AHS, that money isn't going to instead, I'm picking on other departments and I don't mean to because they're all valuable, love them all, but I don't know, like Fish and Wildlife. That's what I know.
Right at you.
I just want to make sure we've invested this in the people of Vermont and the health of the people of Vermont. I want to make sure that money is going to.
Right. And this is why we bring all the agencies in when we do BAA and we do budget and we get the, periodic reviews of what's happening. And then we have the conversation, which we're going to have this afternoon, of what do we give as a recommendation to House Appropriations, and then it's in their hands. But these are great questions and we need to keep asking them and keep, following the money. Leslie, and then we should be done.
The VDH budget goes to Human Services.
Yes. Yeah, sometimes it comes here, but
That was, I remember seeing it, so I was wondering, so we're not going to see it.
I just make one last final comment.
Yes, and then we're really done.
When we're done. The global commitment has been a very good thing for the state. The problem is that it's financially complicated and there's no easy way for it to be as transparent as we'd like. So when it's hidden, it's not like it's hidden intentionally. There's just no easy way. So I'm just trying to highlight that we're lucky to have it. Unfortunately, it's complicated to follow. And sometimes it just makes things frustrating and confusing.
Yes, and I want to be clear, we are not indicating at all that there's something going on in the numbers. We just really want to understand what the numbers are showing us and then how that affects our policy decisions. So, as always, thank you all for coming. We will see you next week.